SAMEC Trust stands for Service Access to Minority Ethnic Communities. It's the only national charity that provides groundbreaking health information to ethnic minorities. It was set up in 1994 to deal with illnesses that affect certain communities more so than the general population. For example, Asian communities are far more likely to have coronary heart disease, diabetes. African Caribbeans are far more likely to experience things like stroke and cancers such as prostate cancer.
My name is Alex Addo, and I was first diagnosed with prostate cancer about 3 years ago. If you don't get an early treatment, the thing will spread in no time. Some of the African people here are very naive. They are scared, so they don't make any reference to their GPs when they go to them. These leaflets SAMEC produced really saved my life, and I'm still living. There are people who are going through this ordeal but do not know which way to take. They just do not know. So SAMEC is the torchbearer of this thing now.
Sunny is my nephew. He started going to the school. This is when we found out that he's got something's going wrong with him. He's not like a normal kid. He's not engaging with other kids. He wasn't talking to other people. There is not much awareness within the Gujarati community about what Asperger's syndrome is. Even when we found out ourselves, we had no idea what it was. Some people just say it's genetic. They blame my sister that, oh, it's coming from your family side. They really had no idea. There's a proper ignorance there. I was doing the Google search, and this is how I came across SAMEC. SAMEC helped him to become independent. They brought in this routine structure in the house, which he never had before, and that's how he became less frustrated. And because of the SAMEC, you can see what he is now. When he was really young, around 2 years old, he had full hair. Then he started losing the hair in the little patches. We contacted SAMEC again. He never used to have any healthy diet. He never used to have any vegetables, proteins, carbohydrates.
This is me when I was really young with lots of hair. The SAMEC Trust said to me that I need to eat more fruit and vegetables so my hair will grow back, and that is really helping.
The whole issue of health cuts across all generations. And we believe at the SAMEC Trust that prevention is far better than cure. So we try to get the message across the younger generations, because if you're culturally predisposed to certain conditions, you need to know what you need to be eating today to save yourself tomorrow.
Since I've been introduced to SAMEC Trust, I've been more educated about my own well-being as well as the people around me. So it made me think about what I eat, what I do with my life, how I look after my body. My body's a blessing and I want to take care of it. As an outreach worker, I basically go into different communities, most of the time in the mosque, where I see elderly people, maybe vulnerable people. They just sit back, they don't take action, they don't want to bother the doctor. They're spending more of the time seeking spiritual help instead of real medical help that may be beneficial for them. It's basically my job as an outreach individual to tell them in the language they understand and talk to them about different campaigns that SAMEC Trust may have introduced.
Whenever there's a need, Atib is there. For example, there's functions here when we need young people to help the older people, serve them the food, guide them, any assistance they need, Atib is there.
SAMEC Trust provides that someone to turn to. We tell it as it is, and we give people that little bit of hope.
Please support SAMEC. It's helped my nephew Sunny. It can help so many other kids like him.
Please lend your support to SAMEC Trust by volunteering or donating. Thank you.